Hi, I'm Brendan Ebi. I'm a stroke and interventional neurologist with Washington University. I'm a proud product of the state of Alabama. I went to college and medical school there, and that's where I met my wife. We were looking for excellent training and found a position with Washington University for the two of us. We had to leave for a short period of time to finish our training. We did fellowships, but when the opportunity came for us to be able to return to St. Louis and continue our careers, we jumped on top of it. Now we have two young sons, and it's a very family-friendly city, so we've really enjoyed being able to come back to St. Louis. I think I knew pretty early on that I wanted to be a physician. Both my parents are actually physicians, and I had a lot of exposure at home, and I realized it was just such a rewarding career. Neurology drew me in just because the brain is so fascinating. As soon as I took neurosciences in medical school, I realized that's what I wanted to do. And I ended up going with neurology because I felt like I could be a full, comprehensive doctor, take care of somebody from the initial complaints, going through all of the diagnosis, and being able to treat them. And I found an avenue through stroke and interventional neurology where I felt like I could do both, where I could see the patient, make the diagnosis, and then provide treatment. We take a multidisciplinary approach. One of the things that drew me to Washington University and keeps me here is that I have amazing partners across a whole host of specialties, including neuroradiology and neurosurgery. And any kind of complicated case we review in great detail. We come up with the perfect and right treatment plan for every patient. In that same sense, I think that communicating with primary doctors is the bedrock of being able to take care of these patients. We can have the expertise to know about the specific disorders here, but making sure that we're thinking about everything that goes into a patient, all of the medications that they're taking, making sure there aren't any interactions, and making sure that we can work together to come up with a plan, I think is very important. I'm fortunate to be able to work at a couple of different locations, including our major tertiary care hospital and smaller community hospitals, while providing the same level of care. You know, Washington University is world-renowned, but I think that we're doing a disservice if we can't even give that to the neighboring communities and the suburbs around St. Louis. And it's really helped me as a physician recognize the barriers that a lot of patients can face trying to get in to see doctors and get the treatments they need and be able to provide better care. When a patient is able to get back to the things that they like to do, that is by far the most meaningful part of what we do.